Good evening, everyone. This is Meldita and I'm back. So I'll be talking about management of symptomatic ventricular tachycardia with pulse. The patient here is conscious but hemodynamically compromised. Okay, on my right side here is the ventricular tachycardia. Okay, so that is monomorphic VTAC and it's coming from the right ventricle. Okay, and down here is fascicular VTAC. So the patient has, the patient has a blood pressure, the patient is conscious, talking and everything fine, okay? But just so you know, patient varies, okay? So here on the patient assessment, from my previous video, I spoke about asymptomatic ventricular tachycardia. So this time it is symptomatic, but if you look at my patient assessment here, there are some signs and symptoms that they share, okay? Both the patients from the other side and this one is they're conscious. There's palpitation. The heart rate is more than 100 beats per minute. It's a wide complex tachycardia. However, symptomatic ventricular tachycardia has more, and there are perfusion problems here. The patient starts to get dizzy, lightheaded, the blood pressure starts to drop, they're short of breath, or chest pain. Okay, so the patient is not tolerating this ventricular tachycardia, starting to fall apart a little bit. Okay. So in CCU, we work as a team, okay? However, the nurse in charge of that patient will continue to monitor her or his patient, will do the assessment and the monitoring. Then the others will start calling for stat ECG 12 leads. We will start an IV normal saline to KVO. If the blood pressure is getting lower, we can actually increase the flow rate. Just to be sure your lungs are okay, SATs are okay. And another IV access has to be done as well. If the first IV fails, then we have, a backup. The crash cart has to be at bedside already. And the defib pads or patches will be connected to the patient. And then we'll check the last blood works. We'll still do stat blood works. And then we'll call stat and update the cardiologist. So we anticipate that these things will follow, okay? Because the patient is falling apart, so we have synchronized cardioversion. Well, there's still heart rate, the patient is still talking. So we anticipate a possible synchronized cardioversion, and this will be under conscious sedation. Either there will be an anesthesiologist at the bedside, or the CCU nurses and the cardiologist will be dealing with the patient. Okay. And then class 3. This could be started. Usually the common class 3 medication that we start here is amiodarone. We bolus, we give the infusion, we follow the protocol. We supplement the electrolytes. Usually potassium and magnesium are used to supplement the patient. Very common for wide complex tachycardia. Sometimes the cardiologist will order for coronary angiogram, and if there are blockages, then they will put a stent. Okay, and we will also find out the ejection fraction of the patient, whether it's low or normal. There's also an echocardiogram. This is not a rush procedure, but this could wait till tomorrow or the following day. If this today they do it, then tomorrow will be the echocardiogram. Okay, EP consult. Usually if the electrophysiologist will come to the unit, he will try and see the results of the angiogram and the echocardiogram, and then he will make his decision. If the ventricular tachycardia is not recurrent, then the electrophysiologist and the cardiologist, they might just settle with antiarrhythmic medication. If the symptomatic ventricular tachycardia will recur, then the electrophysiologist doctor might suggest probably ablation or an ICD insertion. This is all his decision. Okay. So this management of symptomatic ventricular tachycardia, I have 3 videos. So this is my first video. The second video will be the defibrillator, which has the cardioversion, synchronized cardioversion. And also we will discuss more about the defibrillator as well. Okay, so if you think this information is helpful, so you are welcome to subscribe at my YouTube channel here. This is MELDITA'S Info Corner. I got also a Facebook in case you want to ask some questions or anything that concerns that you're concerned with. So just let me know. And this is my FB here. That's my name there. joanregacho@yahoo.ca. Okay, so looking on my left side here, we are done with the asymptomatic ventricular tachycardia. I did that. That was my last video before this. And then this one here, we're getting close to finishing as well. I got 2 more videos to follow. And if this will be done, the symptomatic and asymptomatic ventricular tachycardia with pulse, then the last topic will be the management of ventricular tachycardia without pulse, which is the cardiac arrest. Okay? Thank you and have a nice evening, guys. Till next time. Bye.